Fainting causes and treatment. Fainting or syncope is a sudden and temporary loss of consciousness. It usually happens when there is a slight decrease in the amount of oxygen reaching the brain. Possible causes include poor circulation, the use of certain medications, low blood volume, for example due to dehydration, emotional distress. Fainting is not usually serious, but sometimes it can indicate an underlying medical issue. People should treat every case of fainting as a medical emergency until they have uncovered the cause and treated the symptoms. What is fainting? Fainting is a brief loss of consciousness that can occur with or without a serious medical issue. It can cause a person to slump in a chair or fall to the ground. Most people wake up after a few seconds and can remember feeling a little dizzy or sick before fainting. Health experts associate fainting with decreased oxygen supply to the brain, but usually not to a degree that is dangerous. Causes. Different underlying conditions can cause a person to faint. We discuss some of them in detail. Neurocardiogenic syncope. Neurocardiogenic or reflex syncope happens when a temporary problem arises with the autonomous nervous system. The autonomous nervous system is the system that controls the body's automatic functions such as heart rate, breathing, and digestion. Health experts also refer to neurocardiogenic syncope as neutrally mediated syncope or vasovagal syncope. In neutrally mediated syncope, a drop in blood pressure slows the heartbeat and pulse rate. This temporarily affects the brain's blood and oxygen supply. Possible triggers of neutrally mediated syncope include fear, heat exposure, exposure to toxins, stress, fatigue, pain, being in a crowded place. Around half of all cases of fainting are of this type. Usually, it is not serious and does not need treatment. Occupational syncope. Occupational or situational syncope is a type of neutrally mediated syncope, but the triggers are physical and include passing stools or urine, coughing or sneezing, vomiting, having gastrointestinal disturbances, engaging in physical activities such as exercising or lifting a heavy weight, standing for a long time. Carotid sinus syndrome. This is also a type of neurally mediated syndrome. The carotid artery is the main artery that supplies blood to the brain. When there is pressure on the pressure sensors or carotid sinus in the carotid artery, it can cause fainting. Activities that can put pressure on the carotid sinus include shaving, wearing a tight collar, turning the head. Orthostatic hypotension. A person with orthostatic hypotension might faint after standing up too quickly. Gravity pulls blood into the legs, bringing down blood pressure elsewhere in the body. The nervous system usually reacts to this by increasing the heartbeat and narrowing the blood vessels. This stabilizes blood pressure, but it can reduce blood and oxygen supply to the brain, resulting in fainting. Triggers include having lower than normal blood volume, for example due to dehydration or blood loss, having diabetes, vitamin B12 deficiency, or another condition that affects the peripheral nervous system, using medications such as diuretics, beta blockers, or antihypertensive drugs, having Parkinson's disease or other condition that affects the nervous system, having idiopathic orthostatic hypotension where there is no clear cause. Cardiac syncope. An underlying heart problem may reduce blood and oxygen supply to the brain. Possible heart conditions include arrhythmias or an irregular heartbeat, stenosis or a blockage of the heart valves, pulmonary embolism, heart attack or the heart muscle dies due to lack of blood and oxygen, heart failure, hypertension or high blood pressure. If a person faints and may have one of these conditions, they should seek medical attention. A doctor will likely recommend monitoring and possibly treatment for the condition. Types: syncope and pre-syncope or near syncope. People sometimes distinguish between episodes of fainting by describing them as syncope or pre-syncope, also called near syncope. One definition of pre-syncope or near syncope is a feeling that you are going to faint but did not. A person has symptoms that typically occur before fainting, but they do not lose consciousness. An episode can last from several seconds up to a few minutes. During this time, they may experience lightheadedness, weakness, warmth, sweating, nausea, palpitations, blurry vision. In syncope, the person experiences similar symptoms but also loses consciousness. Experts say these terms can be confusing, as doctors may use different definitions. Whether a person experiences syncope or near syncope, they may benefit from seeking medical advice. Research suggests syncope and near syncope have similar outcomes, and the underlying cause is likely to be the same. Symptoms: losing consciousness is the main symptom of fainting. The following symptoms may be present before a person loses consciousness: dizziness, lightheadedness, nausea, sweating, visual changes such as blurred or tunnel vision, weakness, changes in heart rhythm, a drop in blood pressure. When a person faints, they may fall over or slump, appear usually pale, have reduced blood pressure and a weak pulse. If a person loses consciousness for more than a few minutes, this may be a sign of a seizure or another neurological problem. A person should seek medical attention if this happens. Individuals who faint are unlikely to lose bowel or bladder control. If this happens, it may be a sign of a stroke. Treatment: if fainting could be due to an underlying health condition, a person should seek medical attention. A doctor will likely carry out investigations such as an electrocardiogram or ECG to rule out problems such as heart disease. Depending on the results, the person may need treatment. If an individual with a known underlying health condition faints, it may be that their medications need adjusting or that symptoms have progressed. Addressing the underlying cause can help prevent future episodes and manage the underlying condition. People who are likely to faint at the sight or thought of an injection or blood can tell a healthcare professional before undergoing a medical procedure that may involve this. The professional can then ensure the individual is in a safe position, such as lying down, before starting the procedure. If a person who feels faint on standing up may benefit from ensuring they take time to sit up or stand up, wearing compression stockings, avoiding medications that worsen the problem such as diuretics. In some cases, a doctor may recommend intravenous fluids or medications to prevent fainting. An intravenous fluid or medication is one that a healthcare professional administers into a vein. When to contact a doctor? A fainting episode may be the symptom of a more severe underlying condition such as heart disease. People should seek medical assistance if they have a first episode of fainting, noticed chest pains, or an irregular pounding heartbeat before losing consciousness, have a history of heart disease, sustain an injury due to fainting, had fecal or urinary incontinence any time before, during or after fainting, faint during pregnancy, have recurring episodes of fainting, have diabetes, lost consciousness for more than a few minutes after fainting.